So what we're going to be talking about for the next few minutes is about people who do not meet the criteria for diagnosis of celiac disease, but have gluten sensitivity. And there's a whole range of illnesses that are associated with gluten sensitivity that we'll go through. Gluten sensitivity is specifically defined by at least one author as a condition of some morphological, immunological, or functional disorder that responds to gluten exclusion. Put in English, these individuals may have some of the markers for celiac disease, but they don't qualify for a diagnosis of celiac disease. Their medical condition does, however, respond to the removal of gluten from the diet. Who we're taking a look at with people with gluten sensitivity are those who have gastrointestinal symptoms but don't have criteria that make them have a diagnosis of celiac disease. We're looking at individuals who don't have gastrointestinal symptoms, and there's a wide range of those, who are not getting better, may or may not have some of the markers of celiac disease, but do improve or resolve with the removal of gluten from the diet. And you lean toward looking for this in individuals in particular who have these variety of illnesses and have family members, especially first-degree relatives, who have this disease. There is a condition called irritable bowel syndrome, and irritable bowel syndrome is, as of yet, poorly defined, as certainly in terms of its cause, but basically it is one of the most common gastrointestinal disorders that we see. It's about 10% of the population fall in the category of being diagnosed with irritable bowel syndrome. And with irritable bowel syndrome, you'll have bloating, you'll have diarrhea, you'll have abdominal pain, and for all intents and purposes, many of the exact same symptoms that we see with celiac disease. However, you don't have any of the markers for celiac disease, biopsy is negative, okay? And so something else is going on. And in a certain percentage of these individuals, if we take gluten out of the diet, the irritable bowel syndrome is clear. And we have to be very careful in our diagnosis to make sure what it is we're treating. And especially if there is true celiac disease, we need to get you off gluten, absolutely, positively. So we have people who have irritable bowel syndromes who do not meet any of the diagnostic criteria for celiac disease, but who we take off gluten and all of their symptoms clear. We have people who have celiac disease but still have irritable bowel complaints, diarrhea, bloating, and constipation, despite being truly free of gluten from their diet. And then we have the people who have celiac disease and who we simply take off gluten, and lo and behold, their symptoms resolve. Neurologic disorders is probably one of the most common non-gastrointestinal complaint that we see in people with gluten sensitivity, and in celiac disease for that matter. So there's this overlap again. So the most common neurologic presentations seen with gluten sensitivity are going to be ataxia. This is kind of a drunken gait, difficulty maintaining your balance. You feel like you're walking around on the deck of a ship. Neuropathies, and particularly a sensory neuropathy. All right, and it needs to be a bilateral sensory neuropathy. And it's peripheral neuropathy because there's damage to the nerves, and you get numbness in the legs or the arms, more commonly in the feet. The neuropathy is usually a loss of sensation, though sometimes can also be a painful neuropathy, more commonly a loss of sensation. So in anybody that has a peripheral neuropathy of otherwise unexplained cause, we have to rule out the possibility of either celiac disease or gluten sensitivity. And we're going to find that about 50% of people who have peripheral neuropathy of unknown etiology will in fact be sensitive to gluten, whether or not they have true celiac or just gluten sensitivity. Depression can manifest in gluten sensitivity as well as celiac. Dementia can manifest. There's a whole array of neurologic symptoms, inclusive of epilepsy, as was mentioned earlier, that we can see in not just celiac disease, but also in gluten sensitivity. So there are people who have these symptoms who don't have celiac disease, but do have gluten sensitivity. And I keep repeating myself because it's a bit confusing that there is a difference between gluten sensitivity and celiac disease. Autoimmune thyroiditis, all right? somewhere between 2 to 5% of the individuals who have celiac disease will also develop other autoimmune diseases, and in particular they'll develop autoimmune thyroiditis, Hashimoto's thyroiditis, or Graves' disease. Goes the other way as well. There are people who have autoimmune thyroiditis who are sensitive to gluten who do not have celiac disease. And again, removing gluten from the diet will, in many cases, improve and sometimes resolve the autoimmune response of the thyroid. Schizophrenia. In about 3% of schizophrenics, if you take gluten out of their diet, they will improve dramatically, and the schizophrenia actually may go into remission. Again, there's a group of them who have, in fact, true celiac disease, and and the celiac disease is related to the schizophrenia. And there's a group of them that have gluten sensitivity, not celiac disease, that improve with the removal of gluten from the diet. In putting it all together, celiac disease is a very complicated disease. It has a wide range of manifestations that vary all the way from gastrointestinal to neurologic to psychological symptoms to skin problems and skin rashes. And so you have to be thinking about it. And we're certainly in people who have chronic disease, which is most of the population that we take care of, we need to be extremely vigilant in terms of making sure that celiac isn't missed. But we also need to be extremely vigilant to make sure and understand that taking gluten out of the diet can make a huge difference in somebody's life and actually resolve some of the symptoms. The question is, what's the percentage of individuals who may be sensitive to gluten and thus having symptoms from it? And to date, we don't have the data. And we don't have the data because it's very hard to study. Think about it. I mean, you've got to, how many people you've got to take off. Everybody comes in, all comers come in, you have to take them off gluten for at least 3 months and see whether or not their symptoms resolve. No one's done that study yet. It's a very important question, but we don't have the answer to it yet.